Hi, I'm Nancy Thompson, the 8 Weeks to Wellness Director and Functional Fitness Specialist here at the Springfield Wellness Center. And upper cross syndrome is often a condition that really can contribute to headaches, but there's a lot of exercises we can do to combat that. And what upper cross syndrome is a combination of weaknesses and tightnesses. The weaknesses are often in the neck flexors, having a hard time keeping that neck where it's supposed to be in our posture, as well as weak upper back muscles. The tightnesses occur in the pec muscles because we're often forward leaning, as well as in the upper occipital muscles that help keep our head up, that's right there at the base of our skull. So if we can do some exercises to address those four things, we can really go a long way in helping treat headaches. So I'm going to have Blair here demonstrate some of the stretches and then strengtheners we're going to do today to give you an idea about what you can do at home. The tight pec muscles could be easily stretched with a number of different stretches, but we're going to focus on just using a pole or a doorway here. And I'm going to have Blair bring her elbow up about shoulder high. This is a real nice way to get that pec area stretched. And then I'm going to have her look away from the arm that she's stretching and just turn as far as you can to get in that pain-free range of motion to help stretch this. Stretches, whether they're for post-workout stretches or certainly in treating this type of condition, I try to ask people to stay in those for 30 seconds and make sure we do both sides evenly. So that is the first one, would be a pec stretch. And then the opposing muscle group that we need to strengthen, we're going to actually do using body resistance. I'm going to have Blair again bring her elbows shoulder high and turn her palms out so that, say this is best done at a wall, you can bring your pinky back to the wall and then engage the muscles by reaching straight up and then pulling straight down, keeping the pinkies on the wall, and then holding that down there for 5 seconds. Doing 10 reps of those will help really engage the upper back muscles that are often very weak, besides creating some range of motion to help counteract the tightness in the pecs. So there's a strengthener you can do, again, holding that for 5 seconds and then repeating it 10 times. The third exercise we're going to do is a neck flexor strengthener by moving the head, which is a great form of resistance because it's 10 to 12 pounds. I'm going to have her slide her chin forward and then pull back to retract the chin and stay in that retracted position, holding for 5 seconds again, and then doing that 10 times should help strengthen the neck flexors, but also it's going to feel good. You're moving that occipital area that is tight anyway, so that's really a nice thing to add to your upper cross syndrome treatment. And then the fourth thing we're doing is this is best done on the floor. So the fourth exercise we're doing on the floor, it uses this wonderful tool we call a peanut. And what it is something you could easily make at home. It's 2 lacrosse balls, because they're nice and firm but not too hard, that we duct tape together to form this peanut, which is going to fit nicely here under Blair's head, which is actually the occipital area where the muscles insert at. We want to provide some release there by having her lay back on this peanut. And again, it's really a stretch, a very passive stretch, but the weight of her head is going to pull back onto the floor. Pressing her occipital area into the peanut is going to provide some release and some stretching, staying there for at least 30 seconds, maybe even longer, because it should feel really good. It shouldn't cause pain, to help improve the tightness there, reduce the tightness there in the occipital area. So that would be the fourth exercise that's going to address the upper cross syndrome. If these exercises are helpful or you found them helpful, please share it with somebody you know or make comments and we'll be glad to get back with you.